A very good morning to all of you. Today we are going to do the Neet PG of MCQ challenge Radiology. Radiology has a very good weightage in Neet PG and INSAT. The weightage is about 10 to 15 questions which will come directly. So let us move on to the first MCQ. Which of the following is most likely diagnosis of patient with following chest X-ray? A. TGA, B. TAPVC, C. TOF, D. Epstein anomaly. Now look at the X-ray very carefully. What you see? Here you see a boot-shaped heart. Condition is called Coren's Abbott. So it is definitely the tetralogy of Fallot. It is boot-shaped or wooden-shaped heart, also called Coren's Abbott. Hilar areas are clear, lung fields are clear because of diminished pulmonary blood flow. Large aorta is there and a right-sided aortic arch is there. Now what should be the ECG finding? There will be right ventricular hypertrophy and right axis deviation. Now coming to other options, transposition of great vessels. In transposition of great arteries, you will see egg on side or egg on string appearance. That is, there will be cardiomegaly with a narrow base and a plethoric lung fields. Now what about TAPVC? In TAPVC, you will see enlarged heart and a figure of 8 or snowman appearance. What about Epstein anomaly? In Epstein anomaly, you will see a box-shaped heart. So the correct answer here is C, tetralogy of Fallot. Which sign is seen on ESG when the femoral vein meets the great saphenous vein and femoral artery at the saphenofemoral junction? A. Mickey Mouse sign. B. Tilloch sign. C. Stemmer sign. D. String sign. See, this string sign is seen in Crohn's disease. Now what about stemmer sign? Stemmer sign is seen in lymphedema. Skin on the dorsum of toes cannot be pinched due to subcutaneous fibrosis. Now Tilloch sign. Tilloch sign is a clinical sign in which there is a resonant area between the pubic bone and tumor, which indicates that the tumor is mesenteric, that is, it is having vascular blood supply. Then coming to Mickey Mouse sign. Mickey Mouse sign represents the normal anatomy of common femoral artery, common femoral vein, and great saphenous vein on ultrasound at the level just inferior to the inguinal crest. So it is Mickey Mouse sign. Yeah. Radiation dose monitoring in occupation of personnel is done by A. Linear accelerator, B. TLD badge, C. Gamma camera, D. GM counters. Now, thermoluminescent dosimeter, that is TLD, is a passive radiation detection device that is used for personal dose monitoring or to measure the patient dose. TLD is used to measure external individual dose from X-ray, beta and gamma radiation. It consists of a TLD card which is loaded in a cassette having suitable metallic filter. It is based on phenomenon thermoluminescence, the emission of light when certain material are heated after exposure to radiation. An RLD batch does not protect the worker from radiation. It only detects and measures the radiation. So the correct answer here is B, TLD batch. A remote afterloading dose is used in A. Brachytherapy, B. Electron beam therapy, C. Proton beam therapy, D. Cyberknife therapy. Now this remote afterloading is used in brachytherapy. It refers to a situation in which a radioisotope is placed onto or inside the patient. The radiation source is sealed in a protective capsule or wire which prevents the radioisotope from moving or dissolving in body fluids, but allows the emission of ionizing radiation to the surrounding tissue. The source can be placed into the target tissue or tumor itself, such as prostate or breast, or into a body cavity such as uterine cavity, esophagus, or bronchus, which is known as intracavitary or intraluminal brachytherapy. or onto skin surface to treat cutaneous malignancy. Brachytherapy applicators have been adapted to enable better imaging. For example, CT and MRI compatible intrauterine tubes have been developed for gynecological treatment. Seeds containing are commonly used. 125I is used to treat prostate cancer. So the correct answer here is A, brachytherapy. Identify the given X-ray abnormality. A. Costochondritis. B. Cervical rib. C. Rib fracture second and third. D. C5 C6 spondylolisthesis. It is cervical rib. In which of the following pathology MRI is preferred over CT? A. Pulmonary embolism. B. Tuberculosis. C. Pancoast tumor. D. Pleural effusion. It is Pancoast tumor. DSA angiography image is shown in what is the diagnosis? A. Pseudoaneurysm of internal carotid artery. B. Angiofibroma tumor blush. C. Multiple hemangiomas. D. Carotid cavernous fistula. It is pseudoaneurysm of internal carotid artery. The image shows a well-defined outpouching from cervical portion of internal carotid artery. This is almost remains the same for pseudoaneurysm in any other part of body. So it is pseudoaneurysm of internal carotid artery, which gives a negative test on FDG PET. A. Small cell carcinoma. B. Large cell neuroendocrine tumor. C. Typical carcinoid. D. Atypical carcinoid. So this is a typical carcinoid. FDG PET in carcinoid, that is bronchial carcinoid, comprise 1 to 20% of all lung malignancies. They are a part of spectrum of pulmonary neuroendocrine tumors of increasing malignant potential, ranging from low-grade typical carcinoid through intermediate atypical carcinoid to more malignant large and small cell neuroendocrine tumors. Typical carcinoids have low glucose turnover and therefore 18-FDG PET is not useful in evaluation of these patients. As the malignant potential increases, there is increasing role of FDG PET as given in the rest of the option. Typical carcinoids like well-differentiated neuroendocrine tumors elsewhere in the body. They express surface receptors, allowing imaging with somatostatin receptor scintigraphy, typically with 111 iridium labeled octreoid scan and 68 gallium DOTA labeled somatostatin analogs called as DOTA-NOX scan. So the correct answer here is typical carcinoma. Investigation of choice for detection and characterization of interstitial lung disease is A. MRI, B. chest X-ray, C. high-resolution CT scan, D. ventilation perfusion scan. The correct answer here is C. High-resolution CT scan. High-resolution CT scan is best mode of investigation to diagnose interstitial lung disease. A lung biopsy is required if the clinical history and imaging are not clearly suggestive of a specific diagnosis or malignancy, cannot otherwise be ruled out. HRCT can even delineate the lung parenchyma down to the level of secondary pulmonary lobule. So the correct answer here is high resolution CT scan. Please click the link in the description box to join the Ultimate Neet PG Breakthrough Blueprint. It is a 2-day covering all the 19 subjects. The first 10 people who will click the link in the description box will get the class absolutely free. What is the probable diagnosis? See the X-ray carefully. The four options are A. Thymoma, B. Mature teratoma, C. Aortic dissection, D. Lymphoma. Well, it is a thymoma. Now let us know more things about thymoma. Thymoma is a tumor originating from epithelial cell of the thymus that is considered a rare malignancy. Thymomas are frequently associated with neuromuscular disease such as myasthenia gravis. Thymoma is found in 20% of patients diagnosed with myasthenia gravis. Once diagnosed, thymoma may be removed surgically. In rare case of a malignant tumor, chemotherapy may be used. Thymoma is the most common anterior mediastinal neoplasm. Mean age of presentation is 52, older than teratomas. Most are solid lymphoepithelial tumors of thymus, some are cystic. About one-third are malignant. It is rare in children. Rare in children. So the correct answer here is A. Thymoma. A middle-aged male patient presents with fever and diarrhea for 1 week and acute onset pain abdomen for hours. An erect abdominal X-ray was taken as shown below. What is the probable diagnosis? A. Appendicitis. B. Perforation peritonitis. C. Toxic megacolon. D. Pneumatosis intestinalis. The film shows dilatation of transverse colon and descending colon with loss of hostrations. Dilatation of transverse colon at least 6 cm or more, loss of hostral markings with pseudopolyps, often extending into lumen. It is known as toxic megacolon. So the correct answer here is C, toxic megacolon. In coarctation of aorta, rib notching is seen in A. Third to ninth rib, B. First to ninth rib, C. 11th and 12th rib, D. All ribs. The correct answer here is A. Third to ninth rib. 20-year-old male presented with knee pain on movement and X-ray shows lytic lesion on upper end of tibia. What it is? A. Tibia giant cell tumor. C. Adamantinoma. C. Simple bone cyst. D. Ewing sarcoma. Well, it is a tibia giant cell tumor. Now let us know little bit about giant cell tumor osteoblastoma. Giant cell tumor, also known as osteoblastoma, the peak incidence of giant cell tumor is seen in the third decade of life. The most commonly involved locations include ends of long bone, distal femur, proximal tibia, and distal radius. Roughly half of all cases occur around the knee joint. Sacrum is another common location. Plain radiograph shows an expanding lytic lesion, that is soap bubble appearance, in an epiphyseal location extended to articular cartilage. So the correct answer here is A, tibial giant cell tumor. Judith view of X-ray is for A. Pelvis, B. Calcaneum, C. Scaphoid, D. Spine. It is for pelvis. The Judith view is basically 45-degree oblique view of affected hip. The entire pelvis is demonstrated on each oblique Judith view. The Judith view demonstrates acetabular fractures and hip dislocation. So the correct answer here is pelvis. Yeah. Puff of smoke appearance in cerebral angiography is seen in A. Moya-Moya disease, B. Cavernous sinus thrombosis, C. Cerebral infarction, D. Carotid artery thrombosis. It is Moya-Moya disease. FAST stands for Focused Assessment with Sonography for Trauma. Focused Assessment with Sonography for Trauma. FAST Assessment with Sonography for Trauma. FAST refers to Focused Assessment with Sonography for Trauma. Correct option is A. Which of the following gland tumor produces hot spot on technetium-99 per TechNet scan? A. Adenolymphoma, B. Adenoid cystic carcinoma, C. Adenocarcinoma, D. Pleomorphic adenoma. It is adenolymphoma. Uh, Investigation of choice for leptomeningeal carcinomatosis is A. PET, B. SPECT, JAD. It is the correct answer is gadolinium enhanced MRI. Which of the following is used to differentiate between epidermal cyst and arachnoid cyst? It is DW1-MR sequence. Which artery dissected most commonly following arteriography by femoral root? A. Celiac trunk, B. Superior mesenteric artery, C. Inferior mesenteric artery, D. Gastroduodenal artery. It is inferior mesenteric artery. Radiation exposure is least in the following procedure: A. Micturating cystourethrogram, B. IVP, C. Bilateral nephrostomogram, D. Spinal CT. It is least in micturating cystourethrogram. Frontal sinus can be best visualized by A. Caldwell's view, B. Waters' view, C. Towns' view, D. Schuller's view. It is Caldwell's view. Cerebral blood flow in an asphyxiated child is best measured by NIRS, near-infrared spectroscopy, B. PET, C. Radionuclide imaging, D. MRI angiography. It is NIRS. Egg on side appearance is seen in which of A. TOF, B. TAPVC, C. Uncorrected TGA, D. Truncus arteriosus. It is uncorrected TGA. An absolute contraindication for MRI is A. Pacemaker, B. Prosthetic cardiac valve, C. Insulin pump, D. Cochlear implant. So absolute contraindication for MRI are cardiac implantable electronic devices, CIED, that is pacemakers, ICDs, and CRT devices can malfunction during an MRI. Metallic foreign objects in the eye, objects near the eye can be seen on an X-ray. Implantable pediatric sternum devices are not compatible with MRI. Other contraindication of MRI include bullets, shrapnel, and other metallic fragments, some vascular clips, some medication pumps, some cochlear implants, some neurostimulatory systems, catheters with metallic components, some older cardiac defibrillators and pacemakers, some spinal or nerve stimulators. So the correct answer here is A, pacemaker. Hampton hump is a feature of A, pulmonary tuberculosis, B, pulmonary embolism, C, pulmonary hemorrhage, D, bronchogenic carcinoma. So it is pulmonary embolism. Most sensitive sonological indicator for aneuploidy is gestational sac volume, ground rump length, nuchal translucency, serum beta HCG level. It is nuchal translucency. The gold standard for diagnosis of osteoporosis is dual energy X-ray absorptiometry, single energy X-ray absorptiometry, C ultrasonography, D quantitative CT. It is dual energy X-ray absorptiometry. Maximum permissible radiation dose in pregnancy is A 0.5 rad, B 1 rad, C 1.5 rad, D 3 rad. It is 0.5 rad.